Okay, we should be here in just a second.
Every time I look out at this group after a month has passed by, it feels like 3 lifetimes have occurred in between. And so much has happened, and we should first take 3 or 4 hours to get caught up. Is our live stream up, Penny? Are we ready?
You are.
All righty. Good afternoon, everyone. Welcome to Health Equity and Access Response Team. I'm Dave Roth. Some things about this meeting today. First, if there are new folks with us today, I want to give you a heads up that we're going to take a minute in about 3 minutes to ask you to introduce yourself and help us understand your affiliation and what brings you to the meeting. A reminder that this is a Zoom meeting. It's being live streamed to the public. It's being recorded so that we can keep our members and the community engaged in what we're learning. Please be aware of your background noises and mute yourself when you're not talking. And as we're going to be doing a lot of discussion today, a reminder that as we do have discussion items, please keep your camera on as much as you're comfortable doing that to help us continue to build our relationships with each other. HEART is the team that leverages our diversity to create new solutions so that as we respond to COVID-19, the entire community achieves optimal health and no one is disadvantaged. We are the team that extends our solutions beyond the public health professionals so that our businesses, governments, civic associations, human service providers, and others join with healthcare to change our habits and ways of doing business so that everyone gets to have the best health possible. Remember to mute yourself if you're not intending to speak. We use data in partnership with the community, the best information that's available to us, disaggregated by race, origin, and other relevant identities to identify harms and risk, make strategy, take actions, and measure progress. Today, we have 4 things that we want to accomplish together. If there are new members with us, we want to welcome those and give them a chance to introduce themselves. We want to return to our discussion about education and town hall discussion. I'm going to ask you to think about 3 things for us today in moving forward our community conversations. Number 2, we want to hear updates from the DuPage County Health Department. With Chris's approval, we're going to bump that up to item number 3 at 2 p.m. on the agenda. And then we're going to move the 2 p.m. conversation, which on your agenda is titled, "What have we learned in our COVID response that applies to the wider range of inequities?" There's a subtitle for that I hope will help you prepare for this. This has to do with how shall we shift our framework to be incorporating chronic health disparities that have been underlying many of the COVID harm disparities that we've been fighting against over the past year and a half. And then we'll look at a next meeting date as well. So that's our agenda for today. So welcome everyone. And I'm looking and I'm not seeing a newcomer, but if I'm missing someone, is there someone who's not been with us before? Okay. Well then, welcome. And although we may not all know each other well, we all know each other a little. And hopefully through this meeting today, we will get to know each other even better. I have one more announcement that I wanted to add into this introductory period because we've not taken action on this. You know, at our last meeting, we had a report from Maria Cuevas regarding contact tracing and changes in practice and policy there. And we learned that contact tracing is now moving into the purview of the state of Illinois and away from local health departments. When we had a discussion about that, we came to understand right away that this is diminishing our ability to connect our neighbors to community resources. So I committed at that meeting, and I got some volunteers who agreed to do this, to get together a group of people to think about the implications and what are actions that Hart or our community could be taking to mitigate against that, the worst parts of that change. Haven't done that yet, but I commit to all of you who committed to be a part of that discussion that we will do that. I will be convening a group to have that discussion. And I'm sorry that it hasn't happened so far. All right, so then what I want to do is now move us to the town hall discussion. And let's see if I can share my screen. Would you bear with me for a moment? And I wonder if you're able to see my screen. All right. Thank you for the thumbs up. You'll remember that on January the 10th, we hosted a community conversation that brought together more than 150 of our neighbors to learn about COVID-19 treatments. And we generated a lot of excitement as a result of that meeting. And when we gathered as a Hart team in January, we asked ourselves, what now? We know that we can draw an audience. How do we use this to our best advantage? What are the most important topics for us to look at? The group that was gathered that day did some voting on priorities, and I wanted to remind you of what the priorities were that emerged in that meeting. What you see here are the 6 topics that we considered for next step conversations. And you'll see that the 12 votes, the most votes, went to a return to the topic we had in January, testing positive, now what? A lot of interest in votes for pediatrics and COVID. And then we see also interest in the other topics that are there. So we know that there's a lot for us to engage with. And what I would like to do today well, first of all, let me ask, are there any questions about the topic list that you see here, and what priorities rose up in our conversations? And because when we're done with this, I'll take it off screen so that we can see each other again.
Dave, it's Mila. I just have one question. These all came from the English responses, right? We didn't get anything from the Spanish or other languages that we were trying to reach out with, right?
That's right. Although some of them also came through feedback after the event.
Okay.
From multilingual audiences. So yes, you're right. We didn't have a Spanish question with Spanish responses that contribute to this. That's correct.
Dave, didn't these comments, wasn't this a multi-choice voting that we actually did at the Hart meeting itself, not at the event?
We did, yes. So at the event itself, we got feedback. We asked people to evaluate and to help us understand what questions they have now. Growing out of that feedback came 5 items that we put on this list to say which of these are the most important now to move forward. A 6th came in, the workplace protections, with good feedback from Immigrant Solidarity Dupage saying this is something that's missing that needs to be on here. So this is kind of an accumulated list. Then at our last meeting, we asked each attendee to take 3 votes and tell us what are their most important priorities. And that's how we end up with this list.
I think that for me, the elephant in the room is just that this is such a rapidly changing space in which we all find ourselves. And I'm not as confident as I'd like to be that what people would have chosen to focus on at the beginning of January and at the beginning of March would necessarily be the same thing. The expiration date on people's particular interest in one topic or another seems to be ever evolving. So I'm struggling a little bit with planning off of conversations that we had so far back and wondering if we need to take the pulse or go at it from a different angle to determine where to focus our energy and attention.
I think that's very fair. My thought today is what I wanted to do was propose, and Jan, I'm looking closely at you because you've been a wonderful advocate for pediatrics and COVID. I wanted to propose that we lift that one up as our next focus and confirm with the group that that recommendation is a good idea. And if it's not, then we of course need to reconsider.
And David, might I say, given that the FDA or the CDC actually slowed down their authorization for the vaccine for the 6-month to 4-year-old population, eventually we know that will come. In addition to that, there's already legislation being proposed to propose, I should say, that we not allow our state legislators to pass legislation that would mandate a COVID vaccine as part of the childhood vaccine conglomerate, the whole thing they do. So this may be an even better time to open this discussion, to kind of feel the pulse of the community, to come up with a really effective promotion for when the vaccine is approved for the youngest population. And maybe on the heels of that, because I don't know, I haven't seen any numbers in about a week or two, but the last numbers I looked at indicated only 22% of that is a 6 or 5-year-old to 11-year-old population have been vaccinated. So I know that there is still quite a bit of concern by parents if this is the right thing to do for their child or children.
This is Chris, my 2 cents on that. And Jen, the numbers are better, thankfully. It's 45%. I'll share those in the presentation of 5 to 11-year-olds. So much better here in Dupage than lots of other places. But I do think that is a important area because people do have a lot of questions. And I don't know that we have a lot of answers yet. Kind of wait to see what the data looks like. But I do think that's one to be planning for before that comes out. So I would echo a thought to do something around pediatric vaccines and kids and COVID generally.
This is Karen, and I don't disagree with anything that's been said. The other factor, though, I know that we keep hearing about is this issue of the boosters, and if you're up to date with vaccine versus if you're fully vaccinated. And I just think that those numbers of people who are boosted are probably worse than that 45%. And so I wonder if some of our time could be around that, or if that might be another possibility. And again, I don't think it has to be either or, but.
I think that's a great take and thought, Karen. And I wonder if it's something that can be an overall vaccine discussion that talks about the variety of levels of vaccination.
Right. And why it's important, because that's, I think, the other thing that people are, people who are already skeptical about, these vaccines are just the drug companies wanting to make money off us. Now when they hear you might need a 3rd or a 4th dose, even, it just like magnifies that. And so understanding why that's important, I think, would be very helpful.
We have more information now to share with people that feel like either they've had COVID, so they don't need a vaccine, or they've had a longer and more severe COVID reaction, and so they're afraid to get a vaccine, and they may be open to a booster or the vaccine series now.
And also, it's another way to include the discussion about the mask, using the mask, because there's a lot of controversy in the schools and many places that if they have continued use it or not, or what convenient it is. I think we have to bring more information about this. What is the best thing to do or keep doing about the mask?
Other thoughts?
I have a thought.
Yes.
I would really love to hear maybe sometime or address those, the breakthrough cases of COVID, right? And to maybe speak to that part of the purpose of the vaccine is not to 100% protect you from being positive, but to prevent the serious illness and death, right? Because, for example, two of my kids who are one who's only old enough to have the 2 shots and the other who's old enough to have all 3, both of them got COVID last week in breakthrough cases. And, we're pretty darn sick for about 4 days. And when we were calling in and talking to the schools, they had just done, masks are now optional. And so that's why I'm sure that sort of ticked up all those infections. But the talk that we were hearing back was, yeah, what is the point of even being vaccinated? And so I think that is unfortunately, that narrative is still out there. And I think perhaps a targeted response to that would be really helpful, because I worry about these kids who have not been vaccinated and how sick they'll get. So I would really like to see a discussion around that, perhaps. Thank you.
I was a keynote speaker at an event this weekend on this wonderful, lovely subject of COVID. And that was one of the concerns still. Why, if I get the vaccine, can I still get COVID or contract COVID? And once we explain, and we actually use the flu vaccine as an example of, you can get the flu vaccine and you can still contract flu. But the likelihood is that if you're vaccinated, you're going to have less severe disease. And there was something sort of happened in that room once we gave people that image of what happens when you get the flu vaccine, because no vaccine is 100% effective. And unfortunately, the original messaging by the CDC and others sort of really confused this issue. So I think probably going forward, every opportunity we get to say to people, the vaccine is not 100%, or and more importantly, what the vaccine does do is prevent severe disease. And we can back that up with the disproportionately high number of people who were hospitalized because they were not vaccinated, and unfortunately, those who lost their lives who were not vaccinated. But if I can speak quickly to what Reverend Miguel brought up, the mask confusion, I don't know, how do we communicate what a public response should be to a public health crisis? I know a family, their child was hospitalized last week because he was so stressed by kids showing up at school without masks. We do have children in our school system who have chronic diseases, who are living with diseases that could potentially take their lives, render them immune compromised. And how do we help these children? How do we support children who unfortunately have that experience and understand they need this extra protection? When I say hospitalized, I mean in a mental health facility. And that this was a totally new event, but he totally lost it as his classmates were entering their classroom with no mask on and enjoying it and actually sort of bullying him about it. We need to help that population.
Well, a couple of thoughts. Well, first of all, we haven't heard from, I want to make sure everybody gets a chance to, and then I'm going to try and offer up some ideas or solutions for us for next steps.
Yes, David, I agree that we should at least address mask issue. My youngest was saying that I'm so confused, Mama, should I wear mask or not? He's just 6 years old. So the kids are confused if they should or they shouldn't. We should address this and we should discuss this at least. And about the vaccination too, I'm just concerned that we should not dilute our ask on vaccination by just only presenting through one language. We have to make sure that all the languages, which we worked so hard, we worked 2 years straight for that. So we should continue that effort, and we should not. And now, since Afghan refugees are here, we have to find out what's the situation over there and how many are vaccinated, what is the understanding. They are not concerned. We are working with Afghan refugees day and night. They are not concerned about COVID. Their main concern is affordable housing. Their main concern is how to live their life. Their main concern are so many. They're here, you know, they don't have shoes, they don't have jackets, their basic necessities they don't have. So they're not worried about COVID-19 at all. But we have to make sure that we cover everyone, and we have to make sure that we are there for everybody.
Thank you, Saima. So I'm hearing a thread, and maybe this is in my mind, but I want to check this out with you, that the discussions that we've had about other things that need attention. Karen, you noted the booster, and what does that mean and why is that important? The mask, and I'm hearing that all of these thread through our care for our kids. A lot of them now are whirling around what's happening in the lives of children. So I wonder how it would fit to continue with the idea of a focus on, I'm not sure what the right terminology is, pediatrics and COVID, or kids and COVID, or families, but use that interest of parents as the kind of the base for our education. And we would address vaccination, we would address boosting, we would address masking. It would be kind of a briefing for families who are trying to figure out how to support their children.
And also include a conversation about the parents who are not sure to vaccinate the children under 4 years old, because there's a lot of few information if they have to or not to vaccinate. You know, what is the consequence, or what is the best, you know, for the infants to get vaccinated, because right now they are the more vulnerable, and because they have any kind of protection. So so we can relate it with the keep using the mask, you know, and as I hear, you know, to protect all these children, they needed, you know, very attention according to his needs. So yeah, I know that many parents, there are a lot of mis information, also they don't trust a lot in the vaccine for kids under 4 years old.
I'm not a health professional, so, and Karen, I'm looking at you about, if we kind of sequester the booster discussion in a conversation about kids, does that dilute that too much? Does that kind of deflect too much the value that we want to bring to the community?
No, I don't think so, because I think it kind of goes to, and Mila, it dropped in the, you know, the immune system health, and how just kind of a 101 on vaccinations, I think, because one of the issues that keeps me up at night is with all this pushback about COVID vaccines, if that's going to create more pushback for all vaccines, and particularly mandated vaccines, right? And so I think under, you know, starting to build the understanding of why these vaccines are so important, how they work, how our bodies react to them, and build it. I don't know. I'm hoping it may have some positive impact in the future.
I think it kind of brings in the people that feel like they can't do anything, you know, and there is a lot of anxiety with the, you know, all of this. So if they feel a little bit more empowered with information about how immune systems work, that vaccines fit into this equation, and not everyone has the same risk. You know, because that holds, I think, them back from getting their kids vaccinated sometimes. Oh, they're not really in the high risk category. Maybe it can be brought together as a overreaching discussion on immunity and safety.
You know, I think education is key. In the meeting over the weekend, I asked the question, how many of you know what an immune system is, what immunity is? And quite a few people didn't. And we just keep assuming that people know what the immune system is, what mortality means, what morbidity means. Now, in that same vein, I am beginning to see that with some of these groups, there is now a growing association with the COVID vaccine, speaking to what Karen talked about, and other childhood vaccines. And we're watching what's going on in our legislature right now, because there are bills being proposed to give parents more authority, and the governor or our government less authority to require or to issue mandates for vaccines, not just COVID, but other vaccines that some parents might be against. Educating people, and I'm very biased to the need to educate people more on health issues, may help those who sort of get lost in the dogma and that bubble of what goes on in their various networks, may give them an ability to be more courageous about making a decision for themselves, their family, and the population, versus, keeping this as a cultural thing that unfortunately is starting to grow in our communities across the nation.
This is what I want to recommend. So we now have a fresh look at what are the most relevant and urgent topics. And we know that we can weave some of these together into a focus. And we know that some of them we're going to have to deal with in a sequence. So I'm proposing to the group that we look to schedule our community conversation during the week of March the 21st, and that we look to gather the planning group the week of March the 7th. That gives us 1 week to build that team together. I want to ask the group here, we'll first give a heads up to all of those of you who are on the planning team for the community conversation in January. We'll be inviting you again and hope you will join us. And then I want to open that up to the rest of the group. Anyone else who would like to be a part of that planning, please let Mila know. Mila, is that okay with you? And we'll set up a meeting date that works for the most, the week of the 7th. So let me just put that out there and see how that sounds to people in terms of a timeline. And we're a little vague right now on exactly what that topic would be. We'll have that group meeting the week of the 7th. We'll be tasked with taking the best wisdom that we heard today and putting that into our best program. And so my last request to the group here today is my own impression would be that Dr. Pinsky was an incredibly wonderful presenter to us. He had thought this through. He had good skill at presenting. And I want to task everybody with thinking about who are the experts that we can bring to the Zoom screen that will help us when we do this next event. And we want to think in the most inclusive sense about who those could be. And I want to share a sliver response, Sima, to your thought about diluting the message by making it English only. One of the great lessons we learned from the January meeting is that by utilizing that Zoom webinar platform, we can create language rooms so that the next event that we do, we can include as many languages as we want. All we have to do is bring in interpreters, which we have. We can do 8, 10 languages so that the live event is reaching many languages. And we've also learned that posting on YouTube will allow folks to select the language to translate the English if they would like.
And maybe the idea that we need to focus on a specific topic is something that perhaps we don't need to consider. Maybe it's, do you have questions about ... how your immune system work, how vaccines work, what kids need to have, and make it much more broad rather than trying to focus too much, to the point, and I think, Simon, it was you that said, we pitch it in terms of questions because people respond more. Well, I'm afraid if we don't ask the right question, then people will pass it off. But if we have multiple questions and have, a panel, and surely that would be, most anybody who we're thinking of right now, they would be able to address any and all of those kinds of questions.
And Karen, that's exactly the format we followed on Saturday, this town hall I spoke at. 15 minutes, and they had me to give all the statistics for the area. And then we had a panel that covered physical, mental, comorbidities. In fact, we had a kidney specialist on and talked about why COVID affects certain diseases certain ways, what triggers the severe disease. And we actually planned it, David, for 90 minutes. And guess what happened at the end of 90 minutes? Everybody was still on the call. And we had agreed that no matter what happened at 90 minutes, we would stop. And so we stuck to our agreement there and promised that we would come back. And on that note, can we consider doing this in phases, not just planning one conversation, but Mita looking at setting up a series of conversations and giving, as we did with the previous conversation, giving people the opportunity to ask their questions when they register, and then making sure the panel is prepared to give the correct response.
Yeah, and I would add like dietitians, nutritionists, because I keep hearing people pushing back, like we talk all of this about the vaccines and how important that is. Well, what about more natural kinds of treatments and remedies and so. And I think that although clearly we want people to get vaccinated, I think there is a place for more natural kinds of ways to boost your immune system. So yeah, I think that would be kind of fun.
And so that would give people a chance that maybe see the word vaccine and automatically shut their brains off to it, come to something like this and feel that their viewpoint is included, and then potentially have those discussions.
I would also, can I add and piggyback on that and talk about in terms of nutritional or natural approaches to treating post-COVID infections, because I think that's something that people are very much interested in and learning about how they can recover best with whatever supplemental help that they can get nutritionally and with vitamins and everything. And then another possible idea in terms of when you're talking about the panel, and I really do love that idea of the pediatricians. And also, what about a sports physiologist? Because of a lot of talk about the safe return to play for athletes, especially younger athletes, because of the myocarditis that some people experience, especially some youth. And I know that there is a concern, and I know a lot of young athletes who do have some of those cardiac symptoms. And this might also help drive home the point that we're not just trying to think of COVID in a binary terms, like you don't get it or you die, but that you don't want to get it because it can also give you these long-lasting, very troubling side effects as well.
Very good. Well, I'm hearing a consensus on a style and breadth of presentation with an emphasis on responding to the questions that you and the community have. So what I'd like to do here is say that we've made good progress on what this next one should look like. And I want to ask if you'd like to be a part of that planning group that's going to meet on the week of March the 7th, alert Mila. And we'll be looking at some dates the week of March the 21st. And I encourage all of you who have thought about dietitians, sports doctors, pediatricians, help us with those names of people who would be willing to help us educate and equip the community.
So David, there is another thing which can be next topic, or we can think on the same, at the same time. It's about mental health, as Jen mentioned. And I think every single person was affected by COVID-19 mentally, isolation, fear, anxiety, we all were there. And there are very little support is available in our county especially for different languages, different ethnicities and nationalities. It's zero to none. So we have to think about it somehow, maybe providing a platform, maybe someone who can speak in their languages, but we really need to think how we can provide these services, mental health services, to these communities. At the same time, how teachers are taking care of kids. If there are two sets of kids, one is wearing mask and one is not wearing mask, how the environment of care and compassion and and be inclusive for all the kids. What are the teachers doing? What are the principals doing? What are the parents doing? So I think this is very deeply, we all are hurt because of this COVID-19, and it's we are not expressing it. We have not figured out what are the damages totally, but especially for kids, they are so fragile. And we have the example, Jen just mentioned that. So perhaps we can add that in the same session and also focus a separate independent session just for mental health, and think of finding some resources for those who cannot afford or who cannot find, mental health specialists in their own languages.
And David, we actually had a psychiatrist on our panel this past weekend, and we provided resources, including NAMI, so that those who were present would know who to reach out to. So I think that's a great idea.
Very good, very good. So we're going to keep a running list, but maybe even the more important thing is to be checking in regularly as things change so quickly. All right, well, I thank you all for that. And I want to bring this part of our meeting to a close, and I want to transition us to Chris and to a COVID-19 update.
Excellent. Thanks, David. What does our time look like?
Can you go for 20 to 25 minutes?
Yeah, sounds good. And happy to take questions along the way too. Dave, can you see a full screen or a presenter view?
Full.
Okay, excellent. Hi, everybody. As usual, I've probably got more content than we'll have time to get through, but my hope is to give you some of the information to take out of here and be able to use with the different groups that you work with, or at least give you a jumping off point to find more information. So the best news that we could possibly have in today's update is, in general, we're seeing these really big, steep declines in the number of new cases being reported from where we were back in January. In January, we had days where we had 2,000 and 2,500 new cases being reported every single day. And knowing that even those days, we weren't seeing all of the results because some people were testing at home. Those are not reported. We don't know about those, but we had thousands of new cases reported every day. Earlier this week, we had a day where we had 67 new cases reported, which is just a tremendous improvement. And we know absolutely that the number one best way to reduce the risk of transmission in our community is to bring the number of cases down. We can have great treatments, we can have great interventions, But if people don't get infected in the first place, that's much better. And so we really want to keep driving those case numbers down as low as possible. Now we continue to be in high levels of transmission by the CDC's definition. We expect that they're going to have some announcements on those community transmission levels and how they're measured later today. So keep an eye on that. And our rates are so much better than they were. But it's sort of a, if we go through a period of really cold days and we have a 25-degree day, you feel like, oh my gosh, it's a heat wave. It feels great. If you have a bunch of 70-degree days and all of a sudden it's 25, you think, oh my God, this is out of control. So our baseline is kind of shifted. Right now, 1,000 cases a week sounds pretty good because we were at 10,000 or greater. So we still need to bring those numbers down. We know we're not going to get to zero necessarily, but we want to keep pushing to bring those infections down, because the fewer people who are known to be infected, the fewer chances that those people will infect others around them. You can see this just massive spike of cases that we went through. We're down now to a much lower level, closer to where we were in the fall. Right now, our 7-day average is about 132 cases being reported every day. So much better than where we were over the past 2 months. And we want to keep driving those numbers down to the extent that we can. I flagged and just put the charts in here from our dashboard. Hopefully you all have the link that's on the bottom of the page here and are using that. But we continue to see these disparities in race and ethnicity across cases and deaths in DuPage County. So even as cases are lower, we know that there are disparities in who's contracting COVID, who's at risk. And we can't just kind of wash our hands and say now, well, cases are down, we're kind of done with COVID and we're moving on. We have to continue to focus on these areas. And for the people that are at higher risk by virtue of what they do or their health conditions or health access, and really make sure that remains a focus. So I put these here just to call them out for your attention. The summary statements are included on there to help kind of summarize what that data is showing us. Nationally, cases are going down. So that is one thing. What's really encouraging is that this tends to be, we've seen these waves of case activity come and go across the country. On the bottom there, you can see 1, 2, and 3 months ago, a month ago, everybody in the whole country was on fire, raging inferno of COVID cases. We're starting to see that move down across the country. Illinois still has a fair amount of activity, but we're coming down like everybody else. So we'll probably be in a position here where there'll be less case activity than there has been for a period of time. What we don't know is how long immunity from these previous infections will last, or whether another variant will emerge. So we're going to continue as the health department to keep an eye on this, and certainly the public health systems are going to keep a close eye on what variants are being identified, how much case activity is there, and really trying to stay ahead of anything that's coming next. The excitement is palpable for the announcement to take masks off on Monday. Many states have done that. That feels great to a lot of people. To many others, many of us potentially, that feels like, wow, we're getting rid of a lot of things all at one time. So we don't believe we are totally done with COVID, and we'll continue to share and monitor this data with you. When we talk about variants, almost everything that's being seen right now is Omicron. Over 99% of cases that are identified and sampled are due to the Omicron variant. There's a couple of different types of Omicron that we're kind of keeping an eye on now. BA2 is the third line in there, and one you may have heard about emerging in some of the European countries. Appears to be a little bit more transmissible than even the original Omicron. It doesn't seem to be causing more severe illness or death, but it is more transmissible. So here we go. We've got another variant that's emerged that may be even more transmissible. So for that reason alone, we know that we're not done with COVID. And we know that as COVID spreads around the world, the opportunity for these variants to emerge will continue. So this is going to be an area to pay attention to. Our hospitalizations, similar to cases, have come down dramatically from where they were a few weeks ago. If you remember and think back to what it felt like in January, when our friends, our family, our colleagues in healthcare were just crushed by the overwhelming surge of patients coming into our hospitals and health systems. We're seeing a very strong decline in those cases, which is really, really encouraging. But our health systems are not, they've been through a really rough period. We want to make sure that we keep case activity down so that we can get back to taking care of all of the other chronic conditions that we and those that we love and work with suffer from and will need healthcare for. So this chart will show you that we're down about 50 people per day being hospitalized in DuPage in the 6 hospitals for COVID. That's down tremendously from a near peak of 500 a day. So really, really good improvements. And we want to keep that up to give our healthcare workers, our health systems, a chance to rebound and get back into more traditional patient care. The surge in January was bigger than it has ever been during the pandemic. So again, the idea that, well, Omicron was less severe or Omicron wasn't as bad. Absolutely. For people who are vaccinated or had some previous immunity, there was absolutely a benefit to that experience. However, we still saw these really crushing numbers. And that's what we really have to be prepared to minimize is any unnecessary illness and death, but also the impact on these health systems that limits our ability to take care of the heart attack or the diabetes episode or the car crash. We cannot have our hospitals this full again. In terms of deaths, we saw a big increase in the number of deaths over the past few weeks. These numbers are not final, so remember the deaths tend to lag new infections and hospitalizations by a few weeks. The data itself takes some time to come in. So you've seen this increase, and it looks like that's back down to 0. Those numbers will change as more complete reporting comes in, so take those with a grain of salt. But we have seen over 1,700 DuPage County residents lose their lives to a COVID related death, which is really unfortunate and preventable in many cases these days. Now, in terms of vaccines and boosters and cases, we've had a lot of questions the past few weeks, and I know some of you have voiced this on the call that people are starting to feel like, why do I even need to get vaccinated? If I'm going to get sick anyway, if it's inevitable that we're all going to get sick, what's the point? So there's some really great data that's now coming out of CDC a little bit more quickly. It's been tragically behind, but they seem to be speeding up a little bit. So this chart here, and there's a lot going on, so I'll talk through some of the key points, shows the rate of COVID cases by vaccination status and booster. So those 3 lines show you the black one on top is people who are unvaccinated. The middle is those who are fully vaccinated without a booster. And the dark blue solid line is fully vaccinated with a booster dose. What that shows you is that people who are unvaccinated are 3.2 times more likely to be positive, to test positive for COVID than somebody who is fully vaccinated with a booster dose. So yes, that gap has got a little worse in December and January as Omicron emerged. But vaccines provide a huge benefit. If you can reduce by 3 times your likelihood of being infected, I would take that. And I hope many people would take that. So I think important to flag that those vaccines, the boosters, do provide important protection against being infected in the first place, which is important to prevent those hospitalizations and deaths down the road. In terms of hospitalizations, again, the rate of hospitalization of people who were unvaccinated skyrocketed in November, December, and January. This data is only through January 8th, so I would expect it to look even worse in a few weeks as the data for January catches up. But for anybody that questions whether getting vaccinated is worth it these days, it just becomes more and more and more clear every time this data gets updated, how much more likely it is that you will end up in the hospital if you are not vaccinated. Through January, CDC's summary is that for adults 18 and up, you were 16 times more likely to be hospitalized if you were unvaccinated. Even in kids, young adults, 12 to 17, kids who were unvaccinated were 8 times more likely to end up in the hospital as a result of their infection than those who were unvaccinated. And those rates just creep up as you look at older segments of the population. So the vaccines do work. They work in every age group. They're providing tremendous benefit. And when you look at the worst outcomes, the takeaway really for this slide is the blue shaded box on the bottom right that says unvaccinated adults age 18 and older were 41 times more likely to die of COVID-19 in December than an adult over 18 who was fully vaccinated with a booster dose. 41 times. There are very few things that we have that reduce our likelihood of death by that magnitude. And so we know these vaccines work. This is clearly not purely a data issue or an evidence to, talking to people about vaccines, but the data is there. And so we want to help you see and find that data for those that it makes a difference for, the information that might help somebody move down that spectrum of deciding to get vaccinated. It's there and it's becoming more and more clear. Can I stop there, Dave, for questions on the situation update? And then I'll just talk a little bit about vaccines, testing, and treatment.
There are a couple that have come through. One is about tracking MENA, and I imagine in your vaccination report, you'll look at how that's coming. And there was a question from Lynn about the severity of the new type of Omicron. Any data there?
Yeah, so I'll start with the MENA one, and that, it's limited by the data that's collected by health systems and providers on the front end. So I do think we have more work to do to expand the fields of information that's collected or self-reported by patients so that we get access to that. Otherwise, we're limited to the demographic fields that somebody may have reported when they went to the hospital, or that a healthcare provider is reporting to us through testing. So limited data about that. We do have a little bit better data about vaccination. There's been a big effort to improve that. We're still not able to access that data through the states reliably for our own data, but seeing a little bit better data statewide and nationally for those groups. And then the new variant, Lynn, it's still evolving. I don't think there's a great answer for sure yet. It appears to be more transmissible, but not causing more severe illness than we're seeing with the Omicron strain from November, December. It's a good question, though.
Is when you say more transmissible, are you comparing that to the original COVID or to Omicron?
To Omicron.
So then that's like considerably more transmissible, right? Would you agree?
Yeah, and I don't remember the exact number or the magnitude. I'll look for it after this and post it here, but it appears to be more transmissible than the Omicron strain. So as we saw that blow through the world in every region, and now we're starting to see the Asian and Southeast Asian countries really start to experience high caseloads, it is a real big cause for concern.
And do you know, is there any data yet that shows if you've had Omicron that you're protected against the new variant, or is that going to be muddy waters as well?
It's muddy too. There was a couple of reports this week that showed there was some protection from that, that it was possible to be reinfected, but less likely if you'd recently been infected. And that seems to hold up so far with what we know about there being some period of time where you have a greater protection from a past infection, but that doesn't last forever and it does wane over time.
Okay, I know I always ask you to take out a crystal ball. Thank you for doing that. Thank you.
Yeah, no problem.
Chris, hi. I have my hand raised. I'm visually challenged. That's why I don't write in the chat. Okay. Question: is there any discussion yet to there being a component of seasonality to SARS-CoV-2? Because we saw those numbers shoot up like, extremely fast during what's normally flu season. Is there any discussion about that yet?
Yeah, there's a lot of discussion about what the risk factors are that drive that. It's not clear that it's seasonal in terms of weather. Usually when we talk about seasonality, it's like the weather pattern, but we've seen COVID spread in the summer and the fall and the winter and the spring in different places of the country. So it may be more associated with people's behavior because of the season. So when it's really hot in the South, people are going inside, they're spending more times in crowds together in indoor places. The reverse is true here, but it's not a really strong association because we had huge increases in cases, last summer, and we had huge cases at other points of the year. So there may be an element to it, and it may be more apparent when there's less transmission raging all the time, but nothing conclusive about, this particular season or humidity drives it more than dry air that we know more about for flu and other respiratory viruses. It's a good question.
Okay. Thank you.
Chris, I have a question in regards to sort of the cumulative data versus data that's more time limited. So we have profound evidence that if you look at the whole term of our COVID experience, the health disparities are extreme. I guess the question that I'm asking is when you break that data out and we're looking at February or January or December, are we seeing any changes in patterns in regards to disproportionality in rates of either infection, illness, or death? I'm wanting to sort of make sure that we're not blunting the data by looking at it across longer periods of time.
Yeah, it's a great question. I don't know. I think Rashmi is not on today, Mila, correct?
Yeah, she wasn't able to join us today.
Yeah. So we have not broken it out month to month. We were breaking out some of that data. It's in the map on the dashboard by census tract, and those are still cumulative. So that's something we could look at and figure out if we can present better. I haven't seen really good local data on that. Has anybody else seen it?
I
or-
haven't seen local either, and it may be that we can't do it locally, but even if we couldn't do it locally, if we could be looking at it across a larger area, it just sort of feels like that's a piece of the puzzle that I don't have a good answer for. And I don't know, I know what to hope for. I just don't know whether it's realistic to hope for it. Some of the more recent data that I'm seeing in terms of vaccine hesitance or folks who are decidedly declining to get vaccine would suggest that we've really seen huge strides across and really have some really widely disparate data by race and ethnicity in terms of willingness to either get vaccine or consider getting a vaccine. And I'm just curious whether some of those trend lines that have shifted over time might be shifting here too without us realizing it. I'd like to know it if it were.
Yeah, that's a great question. I'll dig into it a little bit and talk with Rashmi and our communicable disease team and see if we could find something or put it together.
Thank you.
All right, well, I'll keep moving. And again, we'll put the slides in the chat after this. So if I miss something or don't get into enough detail, feel free to follow up. On vaccines, since the last time we've met, we now have 2 COVID vaccines that are fully approved by the FDA, just like any other vaccine that is traditionally approved and authorized. So both Pfizer and Moderna's vaccine for Pfizer for 16 and up, Moderna for 18 and up are now have received the highest level of FDA approval. So if you have folks that were waiting until these vaccines were truly approved or out of the emergency use authorization, we do have 2 of those now. And the emergency use authorizations that allow for vaccine in these other great age groups based on the evidence are all in place. We talked briefly about the pediatric vaccine. FDA's advisory committee was scheduled to meet, as everybody probably knows, back in mid-February, and they postponed, knowing that there's some new additional data from Pfizer about a 3rd dose potentially for that age group that may provide more protection than what they saw from 2 doses. So keep an eye on that. We keep hearing, late spring, March, April, probably, to start hearing more information about that. Our vaccine rates in the county are creeping up 1/10 of a percentage point at a time. So we're now about 76% of all DuPage County residents being fully vaccinated, and just over 80% of those who are actually eligible. So we still have a chunk of people, 20% of people who are eligible have not yet been vaccinated. That's a good percentage of people. We know there's a population there that we can continue to work with. For kids, the 5 to 11-year-olds, we're at 45% of this group that's fully vaccinated and about 50% who've received at least 1 dose. So that means that we should see those numbers grow a little bit, but we still have work to do in that group. 50% is much lower than many of the other age categories across the county. One area we really do need to focus and we need help on is making sure that people who are fully vaccinated get that booster dose. You saw those charts earlier that showed that, as much protection as there is from being fully vaccinated, there's even more protection from getting a booster. And what we know is fairly limited about which populations are boosted at what rate. But overall, 55% of people who are fully vaccinated have received a booster so far. So we've got work to do to make sure that everybody that went through the trouble of getting fully vaccinated knows they're eligible for a booster and should get one and should know the benefit related to that. This is national data. So, Kara, to your question, Jan, to yours, the breakdown of, who is being boosted, who's getting those booster doses, continues to demonstrate that there are some differences in these different population groups. And so the green line is people who have received a booster dose once they're eligible, by their race or ethnicity category. And the yellow is those who have not received the booster, even though they're eligible. So look at Hispanic, Latino, Black non-Hispanics, and Native Hawaiian, other Pacific Islander as being the 3 groups that are further behind being boosted once they're eligible. Again, this is national data. It's not great for Illinois yet, or DuPage, but it might point us in the direction of some areas to look. The data that is available on IDPH's site, so I put a link here if you want to look into it. The data that is displayed here, you got to do a little bit of calculating, so it's not great. We continue to push and ask and whatever other adjective you want to think of, try to get IDPH to be a little bit more up to date on what they're sharing or sharing back with us to create charts that might be helpful. The chart on the left shows those who are fully vaccinated. So of everybody that's fully vaccinated, what percentage of that group is broken up by these race ethnicity categories. And the chart on the right is for everybody who's received a booster dose, what percentage represents those different race or ethnicity groups. So the example I pulled out here is that of, everyone that's fully vaccinated, Hispanic or Latinos make up 11% of the population that's fully vaccinated. They make up only 7.8% of those who've received booster doses. So we know that they're not boosted to the full extent of everybody that's probably eligible. So this is the best way right now for us to compare who is fully vaccinated with who's been boosted. The caravan continues to be out, so please, if there are opportunities, we're happy to partner with you to get out. We'll be at Access Dupage. Thanks, Kara, on Saturday, and at ICNA. Thanks, Dr. Asfar, both on Saturday. So still trying to find opportunities to do that. So I would encourage you to share that link and to request if you think it's something.
You guys are with us tonight too.
Oh, tonight too, yeah, all weekend. I'm going to hit just two more highlights, Dave, and then I'll stop and we can move on or take questions. We continue to operate the testing site in Villa Park. We are going to add a second health department sponsored site at the fairgrounds back in Wheaton starting next Tuesday. We'll send a flyer out about this as soon as we have it, but just want to share with you that this will be 6 days a week. Another option for a PCR test sponsored by the county. There continue to be lots and lots of places to get tested. There are, more, these maps have been updated to remove some of the questionable testing sites that are now under more stringent evaluation from the feds and the state. We would absolutely encourage you to know and recommend to people to use this list of questions. Where does the test get analyzed? Who sends the results? What can I expect? To really make sure they're going to a site that is valid and reputable. And the last update on treatments is really focused on making sure that we get people who have tested positive linked to treatment as fast as we can. We've done a couple of webinars now about this. This continues to be a gap that we're underutilizing the treatments that are available. So there's a couple of nice resources, and I'll share a flyer here too, but trying to share some information about just how important it is if you do test positive to talk with a healthcare provider, whether that's your own or one you find after that. If you think you may experience, severe impacts of COVID, or if you have one of these conditions, CDC just in the last week updated the evidence about what conditions tend to contribute to more severe outcomes. Cancer, diabetes, liver disease, HIV, mental health disorders, obesity, smoking, physical inactivity. These are things that many, many, many people in our community experience. And so really making sure that everybody knows that, if you test positive, that's something you should share with your provider, especially if you have one of these conditions. And we talked with providers in the past week, and the sentiment really was that, people don't even think to report a test that they did at home or through a non-healthcare site to their healthcare provider. And there's no way for a healthcare provider to help you with your care if they don't know you've even tested positive in the first place. So for those that have a primary source of care or a usual provider, so important to just say, I've got this positive test, I feel fine, but, is there anything else I should be looking at? And for those that don't, to be able to provide access to resources that might link them to care. And IDPH continues to promote a treatment locator and map to be able to find a treatment option for those that may not have access through their own provider. And I'll stop there, Dave, because I know we've hit the time, and I'm happy to answer questions in the chat or follow up with anybody afterwards.
Very good. Questions for Chris?
Chris, do you have any updates on access to COVID-19 tests at the FQHCs for distribution?
I don't. I was just thinking about that this morning, that I needed to check in because I hadn't heard anything. We know that Access, VNA, and many other federally qualified health centers are receiving at-home test kits directly from the federal government to distribute free of charge to their patients. They Access and VNA were just starting to receive those in the past month. Didn't have a lot of supply, but were really focused on their patients. The feds have said that those are, they're encouraging FQHCs to distribute those beyond their own patients. So that will be an area for this group to hopefully inform. We've made a plug and had conversations with Hamdard, VNA, and Access about the fact that when they get to the point of having enough, we would be happy and thrilled to work through HART to distribute to those to people who could use those. Anything you want to add, Kara? You've been really involved in that too.
No, I had the same thought that I needed to circle back, and I saw you, so I asked you first. Sorry.
Chris, Mila, Chris, everybody, anybody. Okay, Reverend Miguel. Okay, we saw these horrible numbers for our Hispanic and African American communities for the boosters. So what do we do to get those numbers up?
It's a great question. That's what we were hoping to talk with you all today about. Get some ideas. I think, one of them is making sure that it's clear that those boosters do provide a benefit. It's not like it's nice to have, but I don't really need it. They provide, observable, clear benefit to keep you out of the hospital or dying as a result. But clearly that's not enough to just know that. So kind of put it back to the group to say, what do you think people need to learn about, understand, make a decision about those boosters?
I still go back to, people's immune systems, and especially if they're medically compromised, because all those things that you mentioned, Chris, they affect our community members, our friends, family. If someone has those conditions, are very common. I think that if there's a way to implore, you were vaccinated and now here's where you're at, like on some sort of protection level, and masks are coming off, and, there's this variant that's, kind of out there. I just don't know if we need to get a little closer to some of our cultural groups and ethnicities to understand how to communicate that and what's the best way to do it. I think we have the access. I believe, does anyone believe we don't have the access part figured out? Right now, vaccines seem very accessible, boosters, very accessible. So it seems like it's more about the information.
The group that I worked with this past weekend was actually through Amita Health. And they are targeting the churches in the Aurora, Kane, and some Dupage communities. And they had a really decent number of participants to show up. And again, we did about a 15, 20-minute presentation, similar to what Chris just did, laid the foundation for the panel and for questions to be asked. Do we need to look at doing that in smaller networks in both of these communities, the Hispanic, Latinx, and the African American Black, and I would even say the MENA and the Asian populations as well, because we know there's some disparities there in terms of the numbers. But is that something that we have the capacity to do?
Jan, can I ask you to clarify what it is that you're proposing? Because I don't know enough about the event Saturday to know what you're
what
suggesting.
Amita Health is doing, through their own community nurse, they are reaching out to the churches, and they're creating these events, town halls, conversations, and they're bringing in specialists to talk to people, to have their questions answered, to improve or increase their knowledge about COVID and participation with the vaccine and boosters.
So it's like a hyper-local
Yes.
education event.
Yes. We could look at doing something at Dupage, AME, doing something at this church in Wheaton. I forget the name of it. I'm sorry, I'm not big on my church knowledge here. We can look at doing something in many of our Catholic churches, Reverend Miguel. Is that possible? And just reaching out to people where they are, and Zoom makes it convenient, and having these worthwhile discussions.
I think before to create this event, we need to create like a video, because not anyone has able to attend this webinars or discussions, but we can share the video and present it in any time according to the needs in your place, and then we can bring to the some answers, of that from the people. We can create another webinar, like you say, Janice, and we can probably get more information from the people. Yeah, because unfortunately, right now we got more questions to answers. We're still in there, Like one question, Chris, is that people are asking if the COVID is still Delta or right here in the active, or what about the other variants? Where we are now. Did they disappear right now, or they still affecting? What about flu? Because symptoms, they are similar to. It's so confusing. Even if you have to test them, it's a flu. This people create more questions. Unfortunately, but this is what it is right now. Let's see, as I hear, they move so fast that we're unable to answer that question. But maybe we can pay attention and test, and able to have an answer response to the people. Yeah, but it's a good idea, Janice, but I think again, we can create a webinar by Zoom, because not everyone is able to attend it. So we have to create like a video and commit with the groups and churches, like you said, and other groups to bring this information and then share it with somebody who represents that groups, and that may be working better.
Jan, what was were you the health expert promoting the booster at the event this weekend, or what was the vehicle that carried the message around the importance of the booster? What I'm asking is going to that question.
Amita Health has a significant presence in the Kane County, Aurora area, and with the churches, they've been actually doing some really good community health work there for a couple of years. And I don't know what the vehicle was for promoting it. I got a text, can you help us out here? And I'm like, sure. And I thought I was a panelist. And then I found out that Tuesday, no, you're the keynote speaker and we want all these charts from you. And as much as you and I know, I hate that quantitative stuff. God bless you, Chris Hoff. Okay. I had to dig into that thing and make it happen. But they are well established in the community. They do a lot of community work, and their nurses, their doctors, they work at the community level to make things happen. So, and they have a collaboration of ministers as well that they can reach out to and say, can we do this at your church or your place of worship? So I'm assuming that's how it happened.
Thank you. That's helpful. I'm starting to think concretely about what is the structure of the thing that we could share. When Reverend Miguel talked about a video, to have a core messaging vehicle to take out there, and I'm thinking we're going to have something that will help us when we do our next community conversation, because it will include booster messaging. So we're going to end up with a recording that's available for us to promote and share. And we know that it will be available in as many languages as Google Translate will be able to share. And I'm thinking here, one of our tasks is kind of compiling where are these good messagings happening? Are they in recordings? Are they written? And we want to equip all of our members with those to be able to promote through their own networks individually, as well as us to think about collective or collaborative events that would advance this. And I'll bet, the health department has a number of resources right now on the communications website also that we could pull and, kind of refresh all of our inboxes regarding how to talk about the value of the booster and make sure that's uppermost in our minds as we're moving forward.
Can I say something?
Please.
Hi, yes. My name's Casey, and I'm Solidarity Dupage. Our message has been kind of face-to-face going to supermarkets. The first event that we had about 3 weeks ago, we had over 200 people. And we are also working with churches, food pantries, different organizations, not-for-profits. And also we're making flyers. We've also teamed up with some of the elected officials in certain wards to get our message out, so that they can get it out to the people. But we made a lot of flyers, and we're going to the big supermarkets, the Hispanic supermarkets, and distributing flyers there, letting them know about the events that's happening. And also we are getting the media. We've got Univision and Telemundo involved in getting our message out. And that seems to be helping us, especially in the Latino community where minorities are, disproportionately vaccinated. So that message that we're getting out there, it's kind of working for us. We're also doing videos in Spanish to let people know about the importance of getting vaccinated. And right now we're driving the message of who's going to protect us, because, the mask mandate is ending. So who's going to protect us? We are the ones that are going to protect us. Why? How? By getting vaccinated. And that's the message that we're trying to transmit to the Hispanic community and, minorities.
That's fantastic, Casey. That makes my month. Could you talk a little bit about, is booster a part of the conversation? It sounds like you've got good events going and people are going to get whatever
we have
they
another,
need.
Yeah, definitely. We had over 40% boosters at our other event 3 weeks ago. It was a large quantity, like I said, 40%. There was about 25% first time dosages, and then second dosages too. So it's a combination. We're trying to get to everybody. The message that we're getting out there, it's important, to get vaccinated, not only your first, your second, but also your booster. So we are, pushing that agenda out there. And right now, we're getting the pediatrics. We're going to have the pediatrics unit out here for tomorrow, because we have an event here at Sacred Heart Church, which is also helping us because we're reaching out to the churches too. That is working, reaching out to the churches, to getting people, word of mouth is really helping, like I said, and distributing the flyers. We're telling people, hey, our message was, get vaccinated. It's an act of love, because, we're in February, Valentine's. So that's the message that we were pushing as far as that's concerned. It's an act of love to get vaccinated, not only for yourself, but for your loved ones. And being that in the Latino community, families are valued very highly, we're kind of pushing that agenda. Hey, if you care about your family, get vaccinated, protect yourself, because you're not only protecting yourself, you're protecting the ones that you love.
Casildo, did I pronounce that correctly?
Yes.
Okay.
Casey for everybody. That's
Okay.
what everybody calls me.
Okay. I actually, I'm assuming that Cristobal is sending me these wonderful press releases.
Yes, that's us.
Yeah, you're doing a great job. This is very impressive. Is Reverend Miguel on this list?
Yes, he is.
Okay, great.
Yes. And today I saw in the news and the Spanish news and Univision, the message is very good because you're targeting the Aurora area where they needed this attention, but also still thinking that we need to target to the videos and the small congregational groups or communities to follow up, because we need to insist and be more intentional, and able to be more effective. But this is great. Still, congratulations. I like what you're doing and sorry like that, Dupage, because you're really concerned in small groups. It is great. And so Univision is very effective and Telemundo too. So we have to take advantage of this media. But besides that, we need to follow up this with to the small communities with these videos, what I'm suggesting.
Yes, it's very important. Not only the Catholic denomination, but every church, going to every church. I've been going personally to every church and say, hey, here's 10, 20, 30 flyers. Can you hand them out? Can you spread the message? Can you talk about our event? Just to get that face-to-face with somebody, a priest, a rabbi, a deacon. It's very important. to present yourself and say, hey, we care about your community. Please get vaccinated. Please, first, second dose, booster, whatever. And how else can we help? Because it's not only about that, but how else can we help to help each other?
Casey, it's great news. And I'm not sure when you joined us. We had a conversation earlier about planning a Zoom conversation to help continue education in the community. We'll do this in a few weeks. And I know I would love to tap your network of healthcare professionals to see who of those might be willing to be with us on a panel that would be broadcast across the county for sure.
Yeah, that would be great. Get in touch with me. I'll share my contacts and everything. We're also going to have a physician at site for our event tomorrow from Copley Rush. We're also going to have another organization doing blood pressure and glucose tests. So we're kind of trying to target everything a little bit, offering a little bit of everything for our community.
That's wonderful news. And the messaging that you're using, who's going to protect us, protect your loved ones. Oh my goodness, that's marvelous. That's so appealing. I love to hear that.
Yeah, we got that from an old Hispanic show or Mexican show, El Chavo del Ocho. They say on there, oh, y ahora quién nos va a proteger? Who is going to protect us? So that's kind of where we got the messaging from. And we're shouting, us, me, you, that's who's going to protect us.
Oh, that's marvelous. Are there any other responses to Jan's question about how are we going to get this message out there? I'm aware of our time. We're at 2:53. We're 3 minutes past the time that we had scheduled to adjourn. I want to say that we have some starter agenda items for our next meeting. We did not today talk about the question about, well, we did actually in this conversation, we began to dive into the idea of what's our ability to bring chronic health conditions into the consideration now to protecting our community long-term from COVID-19. So we're going to focus that conversation next time and ask how we, and I want to challenge each of you to think about, if you've worked in the area of chronic health conditions, who are people that we need to have at the table here as we make the connection between our equitable response to COVID-19 and our engagement with those people and systems and groups that are addressing chronic health conditions. We know that's a focus for us to protect the community for the long term. In addition,
David,
yes.
I'm sorry, may I quickly suggest, if we have the capacity, can we also include what is happening behind COVID? What is the pandemic behind the pandemic? Because the American Cancer Society last week released a report that indicated the studies are showing the mortality rate for breast cancer in the African American Black population increased by 41% during COVID so far. And that is heartbreaking because African American women are not disproportionately diagnosed with breast cancer. We just happen to die from it at a much higher rate. That is something, that's one of the things we've got to look at as part of our response to health inequities is what do we do? Where are we, in fact, in Dupage County with health outcomes for the African American women associated specifically with breast cancer?
Our data mirrors the national data, Jan.
Okay. Oh, it does?
Yes, in a troubling way.
That's
It's
heartbreaking.
just, we're unfortunately seeing the same numbers here.
Yeah, that is heartbreaking. So I would like, if we can, put that on our agenda to address. Thank you.
Let's do it. I said chronic conditions, but really health disparities, period, which have been made worse, more difficult, and more harmful because of the pandemic. We'll also spend some time talking about pandemic health navigation. There's another new program making its way into Illinois and into our county, and we're going to want this group to help guide the principles by which that program is implemented in Dupage. And we're going to want to spend some time talking about long COVID, those at risk, and the health needs. I thank you all so much for the time that you've given. Casey, you're the perfect story for us to go out on, because you're giving an example of the hard work that everybody has been doing in the community to make sure that everyone is protected. And I thank you all for that. And I thank you for putting your thoughts and minds together today for us to be better as a community. And I wish you all a very safe and healthy weekend. And we all keep in mind now the thousands of our neighbors who hail from Europe, Eastern Europe, from Ukraine, Russia, Moldavia, Hungary, Poland. All those folks are feeling incredible anxiety right now about what's happening, and our hearts and minds are with them too. So
David, Mary, I'm sorry, Mary Keating just popped back on, and there was something I wanted to, hopefully she can help us with. Can at our next meeting, Mary, are you able to provide some background on what's happening with housing and security in DuPage County? I think that is something we need to look at and address. David, I'm sorry. There I go again. I'm sorry.
Oh, thank goodness. Thank goodness. Yeah, it's right on point. That's right on point.
Sure, I'd be happy to.
And so March 18, and we're back to a morning gathering in a few weeks. All right, thanks all. I wish you a safe and healthy weekend.
Thank
We're
you.
adjourned.
Enjoy the sun.
Okay, thank you.